Hi, welcome to the Kachmann Wellness Show. Today's half hour, as is usual, that we try to do here because type 2 diabetes is our main focus. And I'm going to teach you how to prevent it, stop it if necessary, and if you have side effects from it, to reverse it. That information you will get from me through the words that I give you, and also recommended reading, because you have to gain some knowledge. You can also go onto Facebook, Rudy Kachmann, YouTube, Rudy Kachmann, and learn how to prevent, stop, reverse diabetes. So I want you to gather a lot of information, how to do that. Remember, I was a neurosurgeon. How would you become interested in that? And the reason being is that I saw so many diabetics in my practice who come to see me to get a neck operation or a back operation or had an ache here or there, but the majority of them had complications from diabetes, and nobody was doing anything about it. So that's turned into my main focus. Probably 80% of the diseases that occur in our community are complications of diabetes, and very few people are doing anything about it. And it's not, the public just doesn't know. It's not something brought up at every visit like it should be. And then of all things that I discover, which I'll share with you, is that if you ran blood sugars and serum insulins long before the blood sugar is elevated, the serum insulin is elevated, we could diagnose the path to type 2 diabetes many years before you are diabetic and avoid all the complications that diabetes causes, even in people who have no symptoms. So it is a silent disease for a long time, 10 to 15 years. How did we know that? In the Vietnam War, the Korean War, they autopsied the guys, girls, some girls, many guys of normal weight, and discovered that the Vietnamese had no hidden disease in their body who died of bullets. The Koreans had no disease in their body, almost none of them. And the Americans, 60, 70, 80% had the early signs of vascular disease. They had plaques in their arteries, the beginning of cancers in the first cell in situ, for example. They had many changes in their body, in their kidneys, in their heart, in their skin, in other organs, in the heart. They already had them, but no symptoms. What does that tell me? It tells me if we did serum insulin testing very early in people, even at a very young age, we could do corrective action, and it's a lot easier to learn to eat right or lose 5 pounds instead of 300 pounds. That's what I'm going to be talking about today. So what are the effects of having diabetes? We have type 1 diabetes where you make no insulin. Even they will have some vascular effects. You may save their life by giving them insulin because they can't, their pancreas is dead. But they have found because you're giving them sugar, and if they just eat what they want to and just increase their dosage of insulin, 10, 20 units, instead take 80 or 90 with one of these things you can inject it in, they get a lot of vascular disease too. They may live a little longer because they're getting insulin, but they're dying in their 60s and 70s instead of living to be 100, which I'm trying to teach you to date disease free. So what does diabetes cause? Well, let's start at the top. And this piece of paper I have here if you see me, I'll give you, give you one, mail it to you, or give me a hug, I'll give you one. And a lot of memory loss and dementia, Alzheimer's disease, we all think it's some genetic disease. The majority of the time, 80% of dementia is caused by diabetes. Prevent it, stop it, reverse it, you won't get Alzheimer's. There's about 2 or 3% that's genetic. But if you eat the right food, it will not express, those genes will not express themselves 50% of the time. So Alzheimer's disease really is a preventable disease easily, the majority of the time. You hear about drug companies inventing a new drug, and it's going to let you live longer, a month or two. No, we're talking about preventing it for good. The drugs don't work very well at all. Don't bet your life on the drugs. Bet your life on preventing it, stopping it. And we'll teach you how this is done. So dementia, blindness, retinal disease, a lot of eye disease. One of the first diseases of the eye are caused by diabetes, because remember, in diabetes the serum insulin is elevated and punching holes into the smallest vessels. The smallest vessels are in your eyes, and next is your ears. So a lot of people on the path to diabetes get eye trouble and they get ear trouble. I actually went to two of the best retinal surgeons in town many years ago, maybe 25 years ago. Yeah, I do a lot of stuff even then, and asked them to lead the way to inform people of this. But that, although they were great surgeons, the best in town, what they did, zero. So best way to preserve your vision, don't have diabetes. I mean, some going to get retinal disease no matter what, but the majority is due to diabetes. Dental disease, and that's a very interesting subject because the bacteria that are living on your teeth, they love sugar. Yes, as a matter of fact, a dentist went to 26 countries. His last name is West, W-E-S-T, okay? And you can pull him up on the internet. He did that in the 1930s. He saw so much dental disease that he took a trip around the world. That's a great book to read. Matter of fact, where I do my banking, there was a girl there who recognized me because I would help support a choir, Unity Choir that she sang with. She called out my name, and I gave her that book because she's going to be a dental hygienist. I felt so lucky. I gave her this book and see what she thinks about it and to introduce it, because they hadn't brought it up in her course at Indiana Tech. Mm-hmm. This tremendous book which tells you about the dental, and because she, in that book, Dr. West ran across some tribes in Africa and different places. He went to Africa, South America, North America. He went all over the place. And he would study groups of people and found some had no dental disease whatsoever. They were eating different food. Mm-hmm. Mm-hmm. And some were, teeth were thrown out. And also, I highly recommend you gather some information about teaching your newborn how to brush their teeth, even if those are not permanent teeth. Teach them to brush them then, because brushing your teeth, which I didn't know you had to do till I was in college. My fraternity brother came to me and said, "Rudy, we have girls come over today, would you brush your teeth?" My parents never said it to me, and I already had lost a couple of teeth. If you brush your teeth starting as a child, you may never lose teeth. And these bacteria go to the brain and also to the heart and cause a lot of disease. So mentioning dental disease is important. Strokes, dementia, liver disease, kidney disease, heart disease, multiple cancers, arthritis of the knees and hips. Cancers can be bowel, ovarian, liver. All these can be largely prevented by eating the right food and not being a diabetic. And this is critical. You can stop it, prevent it. And a good book to read here, Rudy's War on Diabetes. That kind of excited me. I wrote a book about it, okay? Vascular disease, impotency, skin rashes, nerve damage, you can become numb and you get neuropathy, numb in your feet and your legs, all can be caused by diabetes. So these things can happen. A lot of the original science about the insulin was really discovered by a gentleman named Joseph Kraft, K-R-A-F-T. You can find him in Amazon books. Maybe you will need to use the Kindle, but because the actual book itself, which you could read in a day or two, is an excellent book. What I have with me, Understanding Joseph Kraft's Diabetes in Situ. In situ means at the very beginning, okay, for type 2 diabetes, okay? And Dr. Kraft is a medical doctor who measured over 14,000 oral glucose tolerance tests in his lifetime in Illinois, the hospital he was in Chicago. And so he was a standard test, and he would measure the blood sugar, glucose tolerance test, where you drink some more sugar in the morning, and he would get a fasting insulin. And what he found is elevated insulin levels in the diabetics long before their blood sugar went up. We should be doing serum insulin testing on even children starting at age 2 or 3, and we would kill the diabetes epidemic. Rudy's War on Diabetes is part of that, and it has a chapter about Joseph Kraft and explaining that in great detail. He developed patterns. He would check the insulin and glucose level an hour, half hour, 2 hours, 3 hours. Actually, he checked it for 5 hours, but by that time, those returned to normal. Well, that's very, you can see him on YouTube. Just put in YouTube, Joseph Kraft. He's 92 years old, about a 15-minute thing. And he died since that time, a few years later. But that work is critical. Don't accept diabetes. Don't accept diabetes. Don't accept diabetes. I've declared war on it, okay? Because it would save you from all those diseases that I already mentioned, and some of them can be reversed. You can indeed get rid of diabetes. What they've shown too was Jason Fung from Canada, who used to be a renal doctor, now he turned to a diabetic doctor because he found every diabetic he looked at had renal disease, kidney disease. Diabetes causes most people in dialysis, 80% are diabetics. And believe me, being in dialysis is no fun. Twice a week you hook up to the thing, sometimes 3 times a week. You get to lay there in bed, and if you stop doing it, you're probably going to die. Kidney disease, they have difficulty reversing it. Vascular disease and kidney disease are related like brothers. And you need to step up to bat because the GFR, get the GFR test, glomerular filtration rate, okay? The blood sugar, the serum insulin, maybe ALT, that tells you about the fat that may be in the liver, the pancreas. Fat in the liver and pancreas can cause insulin secretion, can shut it down, and you're a diabetic. But what he found is you could be a tofu, thin on the outside, but fat on the inside. You have fat in your liver, in your kidneys, but nothing in the sub-Q belly. You look great, but you're still diabetic. So get the testing done even if you're thin, because you could be a tofu. About 30% of tofus have diabetes. Yeah. One thing I read, and I'm not certainly about the reality of it. I did read a book that said 72% of people that are overweight are not diabetic. I'm not sure about that. If they had serum insulin tests that were normal, I would say okay. But again, keep in mind, if you're overweight, you may not be diabetic, but you got to prove it to me. The bottom line is your blood test. Show me your blood test. So we spoke about prevention. Mind you, I'm 39 for the 48th time. All my blood tests are normal. All my blood tests are normal. My serum insulin is 0.7. Okay? HSCRP is a good test too, because it tells inflammation and in vascular disease it gets elevated. Mine is like 0.4. Okay? Am I bragging? No. At least I could be an example if I do the teaching. Was I always this way? No, I don't have a disease, but I'm moving to downtown, so I looked at my clothes and I kept the pants I wore 10, 15 years ago, and I noticed they're a lot bigger than what I'm wearing now. I seem to be at a set point every day, 134 pounds, even if I have a dessert. And that's good to know that you don't need to give up everything, but weigh yourself frequently so you have some idea. Get at least tested once a year if you have no disease. If you have some disease, if your insulin is elevated, get tested every 3 months. Tell your doctor you want it. If not, tell them I'm going to have it and pay for it myself. And so that you want to, this is a disease of prevention and reversal, okay? And because you want to be dialyzed, you want to die young. Diabetics die young, yes. A lot of them get dementia, all avoidable. Increased rates of cancer, all avoidable. What do you do? Got to do what I ask you to do. And here's an interesting book, which I was teaching a church group recently, and about 10, 15 people there. It didn't look that healthy. And I thought to myself, what could be a common thing they all could do together? And I went online, a book I've read many times before, because I like this book, Simply Keto. Simply Keto by Susan Ryan. Susan Ryan. I encourage you highly to read this book. No matter who you are, this book, what I like about it is she lost 125 pounds. If that's your problem, hey, she looks beautiful now. Her husband, same thing. And they start eating the keto way. And she's on YouTube. And you can say YouTube, Susan Ryan, Keto Karma, K-A-R-M-A, in which she has about 10 YouTube shows, talks about the psychology of eating certain foods, because, like I said, if you put a donut there and considering my stress of the day, I might just eat it, okay? I probably get away with it because I don't weigh much, and the rest of the food I eat is good, but the first 60 pages, she explains what keto is. So that's good. And then she has a picture of every recipe in the book. Yeah, every, and she in her book recommends 3 meals a day, which with me and my 16:8 book that I wrote, Prevention is the Cure. Okay, Prevention is the Cure. Another book I wrote many books. Okay, I do fasting 16 hours. I don't eat 8 hours. I eat 2 meals a day. If you make them slightly healthy, you won't get diabetes. And if you get it, it'll go away. What with fasting is that in the morning, here's some important piece of information. In the morning, as light occurs, our body secretes 5 different hormones that keep your blood sugar like this. And because my sugar is like this, I'm not hungry in the morning. I play pickleball, I take a walk, I talk to the birds, I sing to the birds, because of growth hormone, the ghrelin that stimulates appetite, that hormone decreases. The gut secretes CCK, another hormone. Adrenaline is secreted and your blood sugar is like this. You don't need to eat breakfast. That is something that was introduced as we started producing more food to get people to buy it. We actually, through evolution in nature, breakfast was not really in our past. Mm-hmm. So I'm perfectly, I'm not very hungry. And if the first meal you eat at noon could be, say, some eggs, which are good for you, the cholesterol theory is going away. Read a book by Evans, Toxic Effects of Statin Drugs, where they give people to lower their cholesterol. Your brain is made from cholesterol. Every cell is made from cholesterol. You want to take a drug that lowers cholesterol, you're not thinking straight. Read these books, though, and if you're on the medication, don't stop them. Read the books and then show it to your doctor and see if he wakes up. Some doctors have prescribed statins all their life, all their practice life, and I remember one cardiologist came to me and said, that's God's gift to humanity. Statins are not God's gifts to humanity. There's about 6 or 7 books, you can get them all. Amazon books, they pop up. But Evans' book, Toxic Effects of Statins, just read the summary on page 390 or something that shows you that statins interfere with a lot of metabolic pathways, and are very enhanced. Statins actually can cause diabetes and heart disease. Yes, read about it. The company that sell them makes so much money, they're not going to tell you that the doctors aren't telling you, especially cardiologists, is a little bit surprising to me. I can't explain it because I even offered them to get books. Incidentally, if you already have diabetes and you want to get rid of it, get one of these lifestyle libras, Dexcom 8, you put it on here and through your phone can determine your blood sugar. Because if you're dizzy, you don't know it's a high blood sugar or low blood sugar, and you should know by pulling it up. I highly recommend you get one of these. And they're educational. They teach you about what it's affecting your blood sugar, for example. But back to Susan and Ryan. So, and incidentally, if you have friends, it's good to have a friend you're going to do this with. It helps you some support. You can, what I did for this church group, about 15 people, I found online Amazon books. I bought one copy of the book, which was $35. I found used ones for $5 each. And when I got them in the mail, they all looked like brand new ones. So at not much cost to me, 5 times 15, I all gave them a copy of this book. Yes. And about a month later, they had all lost 15 pounds. And their diabetes was going away. Their insulins and blood sugars were going down. This is an extremely helpful book. And every recipe shows a picture of it, and she is on there the number of calories, the amount of protein, the amount of carbohydrates. It's all on there, written on there, how much is in each recipe. Extremely useful information. And you can do the 3 meals a day, or you could do the fasting. I mean, it's up to you. And but either way would be very helpful. another great book to look at. Remember, I'm about gathering information. So what am I really highly recommending? The Keto Way, 50, 70% good fats. You got to learn the difference between good fats and bad fats. There's a whole chapter on that in my book and in other books. Susan Ryan in her book explains to you what good fats are, bad fats are, which are good proteins and good carbohydrates. You get to learn a little bit about the science, a list of foods you should be eating. But here's an excellent book, The Complete Ketogenic Diet for Beginners. Yeah. You know, you want to gather information. You can probably, I paid $12, okay, for your health. To live to be 100, I think it's worth it. You can buy them used, probably for $2. Amazon books, you get them there, and that explains, has recipes in it, and it tells you, you know, a good keto quotient, good up to 69% of the calories in the recipe come from good fats. 70 to 79% of the calories in the recipe come from fat. That's great. That's not only good, but that's great. And then eat some good proteins. Vegetables are not your friend. People say, oh, follow a vegetarian diet. Well, there's a book out called The Plant-Based Con. The Plant-Based Con. I highly recommend you have a look at that, because we need to eat a combination of plants and meat products. A lot of the nutrients, vitamins are not in plants. You think plant, oh, the way to plant-based diet. This really is not true. So gather the information. Like vitamin B12 is only found in meat. Yes, certain minerals and are found higher in meat than in plants. So I didn't say all meat. No, it's a combination, and you need to gather some information. So let's summarize this a little bit. Don't accept diabetes. Don't accept diabetes. Don't accept diabetes. Get a Dexcom 8 or Lifestyle Liver so you can know what the blood sugar is in case you're not feeling right. Don't stop any medication unless you've spoken to your doctor, but you may need to educate your doctor. They get 10 minutes to talk to you. They say, here's your prescription, here's your pill. Well, insulin actually, when you take a shot, causes swelling. If you're going to take insulin regularly, you're going to be overweight. And overweight is what helps cause this disease. Doesn't make sense. These companies get away with that, okay? But don't fall for them. Gather the information, educate your doctor. And even a lot of the diabetic doctors don't teach this way. They want you to have the disease. Why, I don't know. Maybe the lack of knowledge. I don't understand it, but I'm very passionate about it. I put it on YouTube. The nation of India has so many diabetics that they call me up to look at my YouTube shows, which from the library here go into YouTube within 10 days. And you can actually also thank a Dr. Unwin from England. Dr. Unwin, a family doctor, is taking his group that they take care of, and they teach exactly like I do. That's confirmation of the information. So I've given you a lot of information to listen to the other shows, YouTube, and I will have you play pickleball and dance with me when I'm 100 years old. Why am I doing this? It's because I'm a doctor. It's my job. It's my job. I enjoy getting you well. I have a purpose in life. I care about you. See you next time. Bye-bye.